My name's Ron Ehrlich. I'm a dentist, obviously, a holistic dentist. Today's talk is called The Mouth is the Gateway to Health. And, this talk is of interest on a personal level for you, I think, and also professional. I say it's of interest to anybody with a mouth who is interested in their health and has never fully connected the two. And I'll just take you, you better fasten your seatbelts here because we've got a lot to cover, and I'm just going to give you a taste and then leave you with a parting message. Now, this is actually the view from our surgery. Our practice is in Sydney in Elizabeth Street, and we look over the harbour and we invite people, obviously patients, to come in and share our views, but it's not just our physical views, it's our philosophical views. And I think as a practitioner and as a person travelling through life, you need to have a good philosophy, or a philosophy that asks all the right questions and hopefully provides you with some answers. So for the last 35 plus years, this has been the philosophy that I've used in my practice, and it acknowledges that stress is a part of our life, but what do we mean by it? And I think to constructively deal with stress, I think it's anything that upsets our balance or homeostasis. So these are the 5 stresses of life that can break us down, and they're not a linear thing, they're obviously all very much interrelated. And if we know what has the potential to break us down, then we also need to know what can build us up. And these are the 5 pillars of health. There's something nice about 5, isn't there? Because you can count them on your hands and you only need 10, so it seems to work well. But this is the philosophy of health that I've been working with over the last 35 years. That has prompted me to write this book, which is called The Life Less Stress. It's most certainly not autobiographical. It's actually aspirational, more now for me than ever. And it follows people through a journey about why public health messages are so confusing, the difference between a reductionist and a holistic or integrative view of health, the 5 stresses, the 5 pillars. So as things become more complicated in our world, I actually believe the solutions are remarkably simple. Now, my favourite part of my book is down here, where I get to express gratitude, and that's the lesson that I learnt after writing the book, the power of gratitude. So cheap, so powerful, so accessible. But actually today all we're going to do really is touch on this, and I say touch on. So let's make a start. Why include dental stress? And dental stress, we're talking a lot about nutrition, and hey, guess what? The first part of the digestive tract is right here in the mouth, the first line of defence, if you like. And if you think breaking your food down and starting the process of digestion is important, clearly I'm preaching to the converted here, then the well-functioning mouth is really important. And teeth have evolved, I don't want to use the word designed, but okay, designed, evolved, semantics, for a purpose, and that purpose is to break food down, and along with amylase and a lot of other enzymes, starts the digestive process. So if teeth aren't well aligned, it's like using a blunt knife to cut a tomato. You don't do a very good job of it. If you're a mouth breather, eating with your mouth open is not a great look. So being able to breathe through your nose is an important part of chewing your food effectively. And thirdly, if you've got a jaw joint that's clicking or not in the right position, you may not actually you may not be able to chew effectively, and that's not something you give very much thought to. Okay, I know people don't think about how they chew, how they eat, but it's an important part. Now, also, when you look in someone's mouth, you'll notice how pink it is, and the reason it's so pink is because the circulatory system is so close to the surface. And when you combine it with the oral microbiome, you're setting up for, 2 of the most common infections known to man, woman, or child. That is tooth decay and gum disease, both occurring right there in the mouth. I think we can all agree that chronic inflammation is an issue, and the most common site of chronic inflammation is in the mouth. And that leads us into dealing with the materials. Because of decay, we have to restore teeth, and dentists would implant more material into people's bodies than all other health professionals put together. Now, there hasn't been a randomised control study to confirm that statement, but it sounds so impressive, I'd love to make it. And of course, that all has systemic effects. Okay. Now, as well as that, this is an incredibly sensitive neurological area. In fact, 30 to 40% of the body's sensory and motor nerves are in this orofacial area. So I was at the hairdresser recently talking too much and a hair dropped into my mouth and I immediately knew where that was. I could pick it out precisely. If that hair had dropped into my shoe, I would not have been able to, or if I stood on it or someone put it in any other part of my body, I wouldn't have been able to find it. Now that has implications, particularly when you combine it with a neuromuscular system that is significant, particularly when we look at the fact that this is also the gateway to the respiratory tract. So if you think breathing is important, I think we can all agree that's true, and then that leads you on to breathing well. The secret to living a long life is to keep breathing for as long as you can, okay? No big deal. But the secret to living a healthy long life is to breathe well for as long as you can. And there is a significant difference between breathing and breathing well. And the shape and size of your mouth determines the shape and size of the upper airway. So that has a significant impact on breathing. As you know, it's a very important regulatory part of our body. Buffering, very important buffer. We talk about acid-base. I notice alkali water, I won't even go into that, I mean really, but I'm not a big fan of alkaline water, but the way we breathe is a really important way of buffering. And of course, breathing has a profound impact on posture, and people don't think about that. And homeostasis. And then that leads us into sleep-disordered breathing, of which there are many conditions, and that has also an effect on musculoskeletal pain, which we don't have time to go into today, but I think we can all agree that musculoskeletal pain is a significant problem, and if you clench or grind your teeth, not only do these muscles tighten, but so do the neck and shoulder muscles. In fact, there's a Japanese study that shows that calf muscles tighten. So when the jaw tightens, through bruxism at night, the muscles throughout the body tighten as well. We haven't got time to go into that, but clearly sleep-disordered breathing has a significant impact on systemic health. Now, let's not also forget oral cancer. Let's not also forget oral cancer, because oral cancer is the 10th most common cancer in Australia. So I'm sure when you go in to see your dentist, what we do routinely for everybody that comes in to see us every 6 months, we do an oral cancer screening. We look at lips, tongue, cheeks, floor of the mouth, roof of the mouth, back of the throat, and the sublingual glands. Now that is just a routine part of any dental exam that you've ever been to, I'm sure. So that's stating the obvious. But to have seen patients, as maybe some of you have, that have had oral cancer, horrible. Early detection, the most important thing. And of course, let's give a little bit of a mention to health and wellness. It's all connected. So that's why I include dental stress. Now, it's not just me. My book came out in April this year in the UK and in Australia, and in January next year in America. But in January. This came out in April. And this came out, I was very excited, obviously, because it says the story of a hidden epidemic. And who should be writing it? No relation of mine, but Paul R. Ehrlich, one of the world's most famous ecologists. For those old enough to remember, and I'm not seeing many faces in here that are, he was into zero population. You know, he was telling us that our population was going to be a major problem. But on this topic, they say, there's a hidden epidemic going on out there, silent epidemic in Western civilization. It's going on right underneath our noses. Our jaws are getting smaller and our teeth are crooked and crowded, creating not only aesthetic challenges, but difficulties with our breathing. So Stanford University is not just me making this all up. In fact, I would add, there's much more going on than just airway issues, as I think I've already pointed out. Now, many of you will be familiar with Weston A. Price, and Weston A. Price was a dentist who looked for what caused this huge epidemic at the beginning of the 20th century of tooth decay. And what he did was, he went and looked at traditional diets all around the world. And what he discovered was that all of them were not only decay-free, but they also had broad, open arches with enough room for all 32 teeth that we have all evolved to have. And so here he was in Malaysia, in Malaya. Here he was in the Amazon. Here he is in Melanesia. And what he also did was he went down the road. So he looked at what traditional cultures were eating, and then he went down the road into the cities and towns with the same genetic group, and he found that within one generation, they had narrow jaws. So if you think you've got a crowded mouth because you've got mum's jaws and dad's teeth, it doesn't work like that. It's like your mum might have green eyes and your dad has blue eyes, but you don't have one green eye and one blue eye, do you? So this is an epigenetic effect in one generation. And then also what he discovered, not surprisingly, was people in the traditional cultures had no decay. People that had moved and spent a few years in the Western diet had massive decay and all of the chronic degenerative diseases that are going on. So if the hardest part of your body decays because of what you eat, imagine what's going on to the rest of your body. You don't have to imagine it. You're seeing it in your practices. Now, let's just have a quick whiz through this. We heard a lot about the microbiome. And the microbiome, to me, the central question, we talked about it yesterday as in a think tank for Mind, the central question every time you put something in your mouth or on your body is, are you feeding your friends or your foes? You know, that's an important question to be asking. So, you know, here is the oral microbiome. It used to be called dental plaque. There's over 700 different species that we've identified so far. It's a balance, you know, we know that. Now, for those of you that may not, well, it may have been a while since you've studied dental anatomy, so I just want to refresh your memory. A tooth is covered by enamel, a very strong crystalline structure, inorganic. Underneath that is the dentine. It's a softer 65% inorganic, 35% organic. And then there is the nerve in the tooth. Here is the gum, gingiva. So when that becomes inflamed, you have gingivitis. Here is what separates the tooth from the jawbone. It's the periodontal ligament. Periodontal ligament, when that becomes inflamed, you have periodontitis. Here is the nerve in the tooth. And here's what can go wrong. So when your dentist is poking around at the top of your teeth, the decay starts as a little pinhole, goes through the enamel, hits the softer dentine and spreads. The gum gets inflamed here as a build-up. So when you have inflamed gums, gingiva, superficial or deeper periodontitis, the treatment is to go to have your teeth cleaned. We're disrupting. We're not removing all plaque. We're disrupting the plaque. It's the anaerobes that are the most virulent, the most toxic. So that's a really important point. That's why you floss. That's why you brush, to disrupt the plaque. It's the stuff that you miss after 12 to 14 weeks, the late colonizers, if you like, that are far more virulent. So if you have a periodontal pocket, as our hygiene team would do, they would get you back every 3 to 4 months. If you didn't, 6-month, 12-month cleaning's fine. So that's what periodontal disease. Now, when we have tooth decay, you know, people say, my tooth just suddenly broke. It didn't just suddenly break. It was undermined here and eventually became so weak that you bit on it, or your dentist located that this was sticky. You cannot take a dental probe. You couldn't lean on a tooth and break it. So dentists are not finding holes. I mean, they're not making holes, they're finding them. And the thing that goes with that is, of course, to do fillings. Now, if the decay goes further into a tooth, then the nerve in the tooth dies, and it can die quietly. It can die quietly. And the treatment for that is either to have a root canal treatment where the canal is opened up here, the canals are located, measured, opened up, antiseptic is placed into the canal, it's left there, it's vibrated through the tooth, that's then washed out a few weeks later, it's then sealed off here, and this area of infection, which shows up as a shadow at the tip of a root, is what is diagnostic in a way, also that you can't feel the cold. If you put a cold onto a tooth and the tooth's alive, then the tooth's alive. But if you put cold onto a tooth and you can't feel the cold, then it may be dead. You also take an x-ray. So we haven't got time to go into a lot of this, but this is probably, as health practitioners, let alone as, we're all patients, I'm a patient too. This, if you went away with nothing else from this talk, I want you to go away with this, okay? 95% of all oral diseases, tooth decay, gum disease, no pain. So if you're assessing your patient's oral health by saying, are you in pain? Do you have any mercury fillings? Oh, great, aren't you good? You are selling them well short. Anyway, let's push on. Now, gum disease, let's look at what happens. The gum should be like a very tight collar around the tooth, it should be pink, firm and healthy. If you measured the crevice from here to here, it should only be 2 to 3 millimetres, because if the brush gets in here, it's easy to keep clean. But if plaque builds up and pushes the gum away from the tooth, now we've got a problem, because you're still only up here brushing. And so now the bacteria that are forming here, you're brushing here, and every time you brush, the early colonisers come in, no big deal, not virulent at all. But you're missing here, or even worse, here. And after 14 to 16 weeks, the bacteria that are forming there are very virulent. So that's gum disease. Now, interestingly, the impact of the Stone Age diet was explored here on gum disease. So they took, this was in Switzerland, and they took a group of 12 people, or 10, 12 people, and they got them on a Stone Age diet, but asked them not to brush their teeth at all for a month. Okay, so what happened? Well, their bleeding went down. So we'll ask this question in a moment, does your gums bleed? Very important point. Their pocket depths went down. So the depth down the side of the tooth went down, but hey, guess what? Their plaque went up. But was it good plaque or bad plaque? Was it their friends or their foes? So this is very interesting, and making the point that really, someone asked me, what's the best toothpaste? Really? I mean, let's get over that. I know there's lots of great advertisements out there, but it's about what you eat, and it's about how you disrupt your microbiome. This is what goes on. This is the sequence of events. And the circulatory system, the potential for bacteremia is there. The inflammatory response with the C-reactive proteins, which I know you're all familiar with the significance of it, and these are the systemic effects. This is it in a nutshell. And most importantly, again, I want to reiterate, pain. No. This is what still surprises me after almost 40 years of practice. A patient can come in with a cavity, be in excruciating pain. Another patient came in last week, they were concerned about a little brown spot on their tooth. I saw them as a new patient. I looked in their mouth, they had 3 teeth completely rotted down to the gum. And they were concerned about this, and I said to them, have you had any pain? I've never had a day's pain in my life. I'm worried about this black spot here. Okay. Still surprises me. Look, in 1996, I've been a holistic dentist since 1983. I graduated in 1978. So it took me a while to get my head around which way to go, but it's worked quite well over the last 35 years. And I got very excited because this came out in 1996 in a respected dental journal saying, hey, what's going on in the mouth affects the rest of the body. And I thought, wow, this is what is a holistic dentist? I mean, I spend most of my time focused on the mouth, but I have the attitude, I'm a dentist with attitude, and that attitude is, I recognise that there's a patient attached to this mouth, okay? And that may sound obvious, but it's a really important point. Okay, so, the science tells us this is the connection. Here's a question for all of you. How many people, I won't embarrass you, you don't have to put up your hand, but how many people do your gums ever bleed when you brush or floss your teeth? Now, half the people in the room usually put them, more than half to be honest, and people floss their teeth and the gums bleed and they think, oh, look, I'll just leave it alone for a while. Tell me, if your cuticles of your nails bled every time you washed your hands, would your response to that be, oh, gee, I better stop washing my hands for a few days because, that's the only time it really bled? The same occurs in the mouth. Bleeding gums are an indicator of inflammation. In fact, this study showed that bleeding on probing, which is what dentists do as they measure the pocket around the tooth, and if they touch the gum gently and it bleeds, as it might when you floss, that is significant. It can be very significant. So there we are. How common is gum disease? Well, reasonably common, as you'll see. This is 93% of adults have gingivitis. 47% periodontitis, and when you get over the age of 65, that number is even higher. So yes, it is a significant, in fact, the most significant disease. Now, we also have the connection between autoimmune conditions. And let me share with you one particular case, and there are over 80 autoimmune conditions. I've just picked out 4 here, but let's pick out this one. This is rheumatoid arthritis. Now, Dr. Carol Hungerford, a legend in my opinion. Carol is an absolute legend, and she sent me this patient from Bathurst, and she'd been treating him for rheumatoid arthritis for 2 years. Now, he was 62 years old. He quite fit, couldn't get out of bed though, eventually. Couldn't make it from the bedroom to the bathroom. And so this was him, and he came in. Now, when you flick off calculus like this, and you remember that sequence I showed you, bacteremia, systemic, da-da-da-da-da, CPR, this is what you get. Oops, that's not what you get. This is what you get. Okay, so all it did was flick off. I didn't touch it, right? Now, look how inflamed that is. Now, please observe that here is the same as here. So we didn't do anything else. But I got him back a week later, and this is what he looked like. Had done nothing other than just flick that piece off. And when we cleaned them up, a month later, this is pink, firm, and healthy. So what happened? Here is that case. Now, this is an OPG, which I would encourage you to look at. I mean, you know, this is an X-ray you have available to you, and you need to know how to read it, but, you know, hey, contact me and we can run courses and show you how to read it. But this is him. No pain. No pain. And before I turn myself off here, this is a tooth just floating. There's no bone around this tooth. It's just floating in gum. This is a shadow at the tip of the root. Infection, right? So we removed the teeth. We made him a denture, and you know, this is the case. And here he was 6 months later, and he cycled from Perth to Melbourne, and then from Melbourne to Sydney. Now, I'm not going to claim responsibility for that, and I'm certainly not going to promise every patient, if you come in after your hygiene appointment, you too will be able to cycle across Australia. But the point being, this was a significant intervention. Okay, so tooth decay. Well, what are the consequences of tooth decay? You've got to do a filling. And so here are, well, we talk about mercury. Mercury's incredible. You know, I haven't used mercury in my practice since 1985, so I'm a little bit over this, to be honest, but here I'll share it with you. Up until everyone thought mercury, the greatest thing was seafood, you know, and it is. And because of this horrible statistic, 2.3 grams per day if you had seafood every day, and it's getting worse, let alone the plastic. Don't even get me started on seafood. But anyway, mercury. This was always considered the big contributor. Well, in 1991, they invited dentists on and found that actually, hey, these silver fillings are actually half mercury. And so, but the ADA, and this to me I cover in the first part of my book, really, because this is what got me started. There is a safe place, according to the authorities, for mercury amalgam. Yes, there is a safe place, but it's not here. It's definitely not here, because this is against the law. When a dentist does a filling, you're not allowed to put it in the garbage, the toilet, or down the sink. This is the only safe place, according to the authorities, to keep a dental mercury amalgam filling. Yeah, I know, it's amazing, isn't it? We signed a Minamata agreement, and the advantage was it's a win-win. We have to act responsibly and keep mercury out of the environment, but it's a win-win for the profession because we can still use it in people's mouths. So if we are talking about mercury, which I don't think we can argue about is a toxic material, imagine all the more nuanced chemicals that are out there. What hope do we have? Well, the change has to start from us, from the ground up. That's what this is about. So, and there are cracks. It's not such a great material. It expands, it contracts. You may have missed the cracks. And there are significant issues: environmental, occupational health and safety, and public health. So what's the problem with a little bit of mercury? And when we see these symptoms appearing in all of these systems, the skeptics say, well, give me a break, come on. What else does it cause? You know, well, this is a bit, I think, like leaky gut. Leaky gut is a pretty significant part of autoimmune conditions. But how does that present itself? Well, I think it presents itself according to a person's genetic predisposition. So, you know, we get in this reductionist view of what causes that? What causes this? How do we treat this disease? What one supplement do we need to treat this and that? It's just not as simple as that, is it? And so the question is, why? And here it is. It interferes with the cellular metabolism, inactivating sulfhydryl groups on thiols, which are some pretty important biologically active agents. What might they be? Just to refresh your memory. And why might they be significant? Well, here's just a couple that could be interfered with, and I think you could agree that that could perhaps have a significant impact. And if you think, as your dentist may have said, it's crap, it's just an inorganic form, well, there is a thing called methylation, and I won't go into that, making it bioactive. So yes, it may be an inorganic form, but I think most of us will agree bacteria in our bodies have a role to play, sometimes good, sometimes not, and they're good at methylating. So that prompted the NHMRC to say mercury amalgam is perfectly fine, except for people who are pregnant, children, breastfeeding, and if you've got kidney disease, don't use mercury. But apart from that, no problem at all. But if you have it removed carefully, and having it removed carefully means you use dental dam, you use a nose piece to protect the patient's airway, because the shortcut to the brain is the nasal passage. We use high-speed suction, we use air purifiers, etc. And I've turned it off again. And here is, and is there an alternative? Well, of course there's an alternative. Okay, so root canal issues, big controversy. Let me just say this, root canal therapy is the most technically difficult thing a dentist can undertake. So for a practice to say all root canals need to come out, that's an easy way of getting out of problems. It's a nuanced argument. It's a very nuanced argument. This is what goes on. You've got infection at the tip of a root showing up with the shadows, and 12 months later, if the root canal, in case you missed it, the bone regenerates. So my question is, if bone regenerates, has something positive gone on? And in my mind, something positive has gone on. Is it perfect? No, it's not. So there are some pretty important questions here. Not all root canals are the same. Just because someone's gone to the doctor, does that mean, oh, I've seen the doctor, they said there's nothing wrong with me? Oh, okay, well, doctor, tick that box. Not all root canals are the same. Not all immune systems are the same, and even in one individual, it changes. So this is a nuanced argument which leads people into very complex dental work. We haven't got time to go into a lot more of this. I'll flick through it with you. I think I've made the point. It's happening up here. It's about breathing. It's about posture. There's a big difference between mouth breathing and nasal breathing. Huge difference. Huge difference. Filtration, nitric oxide, carbon dioxide balance. How many of you have all 32 of your teeth through and in perfect order? Yeah. No one's putting up their hand. If we didn't have enough room for all fingers on our hands and we all said, oh, look, no big deal, guys, let's remove the fourth finger, it's not doing much. Everyone cool with that? And you'd go, oh, no. Did you have your fourth finger removed when you were 18? Yeah, I did too. Well, we wouldn't do it. Well, it's significant. And here's why. You need room for your tongue. The shape of your arch determines the shape of your upper airway. Here's a big difference between that. This is a big difference. Airway. Look at Chris, look at Paul. Okay? Broad, lots of airway. Narrow, lots of airway. What do you think might happen to the septum in this case? Vaulted ceiling, septed, the septum. Sleep, without a doubt. This is your non-negotiable, built-in life support system. Use it or lose it. Oh, posture. I was going to go into posture. Mouth breathing and nasal breathing make a big difference. Look at this girl a few months later, trained how to breathe through her nose. What does a consistently good night's sleep look like? Like this. It's quality and quantity. What are the problems? Growth hormone goes down. Parasympathetic, sympathetic goes all over the place. Fight and flight. We talk about insulin resistance. The interesting group, here, memory goes down, empathy, forget it. Your amygdala is going crazy. Your hippocampus is shutting down. Depression, oh my God. The number of people that come through on antidepressants, no one's asked them how they sleep. Appalling. Underactive thyroid, is that a problem? Memory, is that a problem? You bet it is. Insulin resistance. After a week of sleeping only 6 hours a night, this is the interesting group, the 6 hour a night group, They're in Chile, they were pre-diabetic. This is the science coming out of America. It's the 6-hour a night group that are the most interesting. So sleep disordered breathing, wow, in kids, huge problem, huge problem. Unlike adults that go dull and listless, kids get hyperactive. ADHD, 48% of kids with ADHD, undiagnosed sleep problems. Bedwetting, going to the toilet at night. I'm sure Rosalba will be talking to you about that this afternoon. But that's about breathing. Getting up at night to go to the bathroom, hey folks, you should know that's about breathing too. This is what it's about, airway closed. This is the gold standard. Dentistry holds a solution. And I think we've kind of I've touched on, made you more aware that no pain and the absence of mercury amalgam is not the measure of oral health, either for you or your patients. Here's my parting message to you. Think holistically. You know, Sydney Holistic Dental Centres in 1983, honestly, I've had so many people give me some kooky things about holistic, but it's the way the body works, it's the way the world works, and we're connected to all of that. Have a clear view of stress, have a clear view of the pillars, take control and be the best you can be. Thank you very much.